Welcome back to our continuing coverage of the coronavirus pandemic on this Memorial Day. Over the weekend, crowds descended on beaches and parks across the country, with many people not social distancing or wearing masks, despite warnings from public health officials. On Saturday, FDA Administrator Dr. Stephen Hahn tweeted a stark warning, saying, with the country starting to open up this holiday weekend, I again remind everyone that the coronavirus is not yet contained. On this solemn holiday, the number of American lives lost from the coronavirus is approaching 100,000. When Donald Trump wasn't busy golfing this weekend, he spent much of his time on social media, spreading disinformation and contradicting his own experts. A short time after the FDA commissioner's warning, Trump tweeted falsely that cases, numbers, and deaths are going down all over the country. Not true. The president's cheerleading for reopening followed his proclamation Friday that places of worship are essential to reopen, threatening to override governors who have ordered churches, synagogues, and mosques not to reopen in the coming days. And tweeting at Fox News last night, he again demanded that schools reopen ASAP. Despite the president's push, Dr. Deborah Birx of the White House task force said on Sunday that places of worship may not be safe for those with pre-existing conditions, and expressed alarm at some of the images that emerged over the weekend.
I'm very concerned when people go out and don't maintain social distancing. We know that it's important for people to socially interact, but we also know it's important that we have to have masks on if we're less than 6 feet, and that we have to maintain that 6 feet distance.
I'm joined now by Dr. Lipi Roy, internal medicine physician, and Bina Venkatraman, editorial page editor for the Boston Globe. The concern, I think, is that Donald Trump does what he does, but it's not as if no one is listening to him and taking his advice. I want to play the senator from Florida, the junior senator from Florida, Rick Scott, who used to be the governor of Florida, who also used to run a healthcare company, talking about this idea of churches reopening. Take a listen.
Do I believe that the government should be telling us what to do? Do I believe the government can tell us we don't have a right to worship? I don't believe they can. I believe I have all Floridians, all Americans have a Bill of Rights, and we have a right to worship if we want to. I believe people are going to do it safely. I have a right to go worship in church service if I want to do it. I don't believe they have a right to stop me.
Bina, what do you make of that line of thinking?
Well, I think it's debatable whether governments have the right. There is an authority for governments to impose quarantines, for example. But this is really not so much a question of whether they have the right to do it, but what the proper role is for government in order to protect people during a public health crisis. And I think you can't help but hold the president and the Republican governors who are sort of conceding to his view of things responsible for people's reckless behavior and exposing themselves and others to this virus and not wearing masks and not practicing good social distancing. And I think if you look at the bizarro world that is the Trump White House, perhaps in that alternate version of reality, they think that nationwide cases are going down. But the reality in the country is that in at least 18 states, cases of COVID-19 are on the rise, that hospitalizations are on the rise as of this past week, and that we very much don't know the impact of reopening states and how new clusters might be formed. We also know that in rural areas around the country, we're seeing new clusters of COVID-19. And even though they don't represent in raw numbers, say, the growth in cases that we were seeing in the early stages of the epidemic in, say, California, New York, New Jersey, relative to the hospital capacity and the healthcare facilities in rural areas of the country, these clusters represent what could be potentially a really high burden of the virus and a reignition of sort of the worst stages of the epidemic for this country.
Yeah, and, we had on the mayor of St. Louis earlier in the show, having played some video that went all over the internet that was quite viral of people packed into a pool all together about 2 hours away from her community, just not wearing masks, not social distancing. Let me play you what Dr. Birx has had to say about asymptomatic spread of the coronavirus. Take a listen.
We've made it clear that there's asymptomatic spread, and that means that people are spreading the virus unknowingly. And this is unusual in the case of respiratory diseases in many cases. So you don't know who's infected. And so we really want to be clear all the time that social distancing is absolutely critical. And if you can't social distance and you're outside, you must wear a mask.
Dr. Roy, is this safe? We're going to try to put it up. People being in either a park or on a beach or in a pool, in water, waiting all right next to each other with no masks on. Is there any circumstance under which that is safe during this pandemic?
Good evening, Joy. I've been taking a global and kind of philosophical approach when I look at these images, but an approach that's still rooted deeply in science and data. And that is that any society that values individual liberties and freedoms over public health and public good will never successfully overcome a global health crisis and a pandemic. You heard that Governor, I believe, Mr. Rick Scott, saying, I have the right, the right to do so and so. Well, I'm sure many of these individuals are saying, well, I have the right to go outside and be in a pool. The problem with that line of thinking is that when you practice your rights, somebody else is going to have to pay the consequence of that behavior. And I'm, of course, thinking of the many people around those individuals who will get infected because, as Dr. Burke said, and as Dr. Fauci has been saying, said months ago, we now have asymptomatic transmission of this virus. And then as a result, going further downstream, and I'm thinking about 2 to 14 days down the road, which is the incubation period, my fellow healthcare workers, nurses and doctors are going to be seeing a surge of patients who are infected and sick, who will need to be intubated. We've already been through that hellish period here in New York State. And I'm just really concerned that that's what we're going to be seeing in other parts of the country.
Yeah, and it is a strange thing for something like a basic recommendation to keep yourself and your loved ones alive has become political, that's become a political thing. The governor of North Dakota had a comment about that. Let's take a listen.
This is I would say, senseless dividing line, and I would ask people to try to dial up your empathy and your understanding. If someone is wearing a mask, they're not doing it to represent what political party they're in or what candidates they support. They might be doing it because they've got a 5-year-old child who's been going through cancer treatments. They might have vulnerable adults in their life.
But, Bina, when people are not wearing a mask, that is starting to seem political, or people saying they're going to shake hands or embrace just to show their politics. It is a bizarre circumstance.
It's absolutely bizarre. And I think this notion that there is necessarily a trade-off between individual liberty and protecting the health of those around us, I think needs to be tempered a bit, because people are capable of making decisions on behalf of the greater good. In vast areas of the country, populations stayed indoors for weeks and weeks, avoided spreading the virus, but they need leadership. They need to be guided, and we need cultural norms. So the idea that wearing a mask is something you do, almost like growing a victory garden during World War II, it's something you do to protect your fellow neighbors, your community members, your church-going friends, your relatives, I think needs to be imbued, it needs to be exemplified in by our leaders. And I think what's unfortunate is the polarization, the politicization of the mask, which the governor so empathetically pointed out is an issue, is making it so that the cultural norm of Republicans or of, let's say, Trump supporters or particular members of our society is to not wear the mask. And I think that that's being used and sort of brandished as a sign of strength or toughness. And I think it's just tragic because it's going to endanger people around those people's communities in their lives. And I think what's unfortunate is that the virus itself is apolitical. It's going to infect red or blue. It doesn't care what your cultural norm is around wearing the mask. It only is trying to find a good, worthy host so it can propagate and survive. And so I think the consequences of this natural experiment where people are practicing really excessive gatherings, almost to sort of flout the public health advice in certain areas, is going to play out. And we're going to see in the next few weeks where the transmission has been accelerated by some of these events. There's already indications that a cluster in Arkansas was triggered by a high school pool party. So this, this image from Missouri is troubling on that score as well.
Yeah, indeed. I mean, droplets and all of the ways it spread. The other issue that's become politicized is Donald Trump's attempt to pitch a treatment. He is not a scientist. He's not a doctor, but he's decided that hydroxychloroquine is the cure. He claims that he's taking it. I don't know if that's been verified. We now have NBC reporting that the World Health Organization has temporarily halted a trial of hydroxychloroquine over safety concerns. Here's a quote from the NBC report. Fears of the drug's potential danger are causing it to err on the side of caution. Cited the British journal The Lancet, which published findings Friday showing that hydroxychloroquine doesn't help COVID-19 patients and might even increase deaths. Are we facing a situation, Dr. Roy, where people are wanting to take a treatment because Donald Trump says they should take it, and not because it would actually help them and that it could hurt them?
Joy, what's really concerning to the medical community when we see things like this is that what we really need is we need our political leaders to lead by example, right? The medical community and the public health community has been saying for a long time now, there's no known FDA-approved treatment for COVID-19. Yes, hydroxychloroquine is FDA-approved for lupus and rheumatoid arthritis and malaria, but that Lancet study, which you just cited, has thus far been the largest study of its kind, looking at over 96,000 people from over 600 hospitals around the world, and the data is pretty clear. The conclusion is that hydroxychloroquine has no known benefit in treating people with COVID-19, and in fact has increased levels of in-hospital mortality and ventricular cardiac arrhythmia. This is not a medication to be taking willy-nilly. It can only be prescribed by a doctor for known conditions. So when you have political leaders like our president taking this medication and then added to that saying, oh, there's no harm in taking it, that's absolutely untrue. Acetaminophen, over-the-counter Tylenol, baby aspirin, they're fairly benign and safe, and yet at the same time, Tylenol is also a leading cause of acute liver failure in this country. There's nothing that we do in the field of medicine that's completely 100% safe. So we need really good, strong leadership that believes in science and data and believes in the words of their public health leaders and authorities.
Yeah, and the last word to you, and I won't even play his soundbite, but Donald Trump attacked the Columbia University study that found that something like 36,000 people could have been saved had he taken action 1 week earlier, and 54,000 had he taken action 2 weeks earlier. He says that Columbia University is a disgrace. He calls it a liberal, disgraceful institution, et cetera, et cetera, et cetera. What do you make of that reality? Because whatever he says, that's the reality. People could have been saved. And that one is to you, Veena.
Well, look, this is a credible study. It's still not peer-reviewed, but it's consistent with the evidence we see from past pandemics, past epidemics, the 1918 influenza pandemic, and indeed from this epidemic where it's played out in South Korea, Germany, other countries, which is to say that early intervention in the course of the pandemic to institute social distancing or lockdowns makes a difference. It saves lives. And the fact that 2 weeks earlier, this model, particularly that the Columbia University researchers are using, shows that 2 weeks earlier, a lockdown could have been effective. We could have reduced by half our current death rate, essentially, or more in the U.S. just by instituting those policies earlier, is a necessary way that science can enrich our understanding of how to hold our leaders accountable for the actions they take or don't take. These models are not perfect, but the data provide a picture of when our leaders should act, and acting on those early warning signs is so critical in public health crises. It's critical in pandemics because these epidemics spread exponentially. If you can contain an outbreak before more people are exposed, you can contain the number of people who will die. And as we reach this mark of 100,000 people, I think it's really important to keep this in mind.
Yeah, indeed. And containing the number of people who die is supposed to be something the president is very interested in doing. Dr. Lipi Roy, Veena Venkatraman, Thank you both very much. Please stay safe. And up next, about half of the country still has not contained the coronavirus, according to a new study. We're going to take a look at Alabama, where there's been a big increase in cases and a growing shortage of ICU beds. Stay with us.
You're watching MSNBC International.